NEM started as our community's response to a lack of cultural competence. We saw it as a need in the Chinese American, Asian American community to really have to provide services with translations, with doctors and nurses and staff that could actually speak the languages of our communities. And so we in San Francisco have traveled this road for many, many years. And I'm honored to sit here and support Speaker Perez's bill, AB 2625, because we are going through a major change in our healthcare system. We're going to be bringing in millions of people into the Medi-Cal system, many of whom are going to need assistance. Right now, we estimate that 1 in 5 residents in California speak English less than well, according to the U.S. Census. We know that about half of the enrollees in the Medi-Cal system need some level of assistance with English. So imagine if you're in a foreign country and you get injured and you have to go see a physician or a nurse and you can't speak the language that they're speaking to you. Well, I actually held a hearing about this last August in San Francisco to really talk about many of the human stories that are really at risk. And what we heard is, no surprise, there was misdiagnosis, there was miscommunication, patients weren't being treated properly, they couldn't get access to translations. Many of them brought their young children, and I can't think of anything more awkward than trying to have your 7-year-old or an 8-year-old try to translate in your language, dealing with very technical terms or health issues. So this is something that's sorely needed, because we heard in our hearing that quite often this translation, being a bridge between the physician and the patient, was really a matter of life or death. And we've heard so often when people did get treated properly, there were serious consequences that people continue to live with day to day. I think oftentimes we in Sacramento and California, we can talk in such broad brush strokes and talk about the numbers, but there are people behind every single one of those numbers. And in every single situation where there's a misdiagnosis, where there's mistreatment, people have to live with those consequences. People have debilitating diseases. People have these physical ailments. So again, we're here today because AB 2325 provides a clear solution. It provides a clear need, and it doesn't really help to give people health care insurance if you don't give them access. Just getting insurance doesn't mean they're going to get care. The only way to guarantee that they can get care is that they can be able to communicate with their physician, with their nurse, with their healthcare provider. And again, that's why we're here today, because NEMS has done such an excellent model of providing that we really want to see that emulated throughout every single healthcare entity in the state.